Diet in diseases of kidneys or kidney diseases. It's chapter 20, page 446. Those who have the textbook, page 446. Those who have the recent textbook, the most recent textbook, please mention the page number in the chat box. The new textbook, page number 446 is as well, or 447. So first, kidney. Where is the kidney? What is the function of kidney? Anatomy of kidney. So it's a bean-shaped organ. Okay, kidneys are two bean-shaped organs that sit just above your waist on the either side of your vertebral column of the spinal cord. Okay, and kidneys are only the size of your fist. One kidney is almost the size of your fist, a little bit smaller, but they carry the responsibility of maintaining the entire body's hemostasis. That means to balance the body's electrolyte. Okay, now it should neither be too acidic nor too basic. Okay, the electrolyte should not be up or high. Proteins or any other organic, inorganic components in your circulation, in your body in general, should not be too high. A balance should be always there. That is the main function of your kidneys. And kidneys have approximately 1 million functional units that are their cells. Kidney cells, we call them nephrons. Okay. So just like how a single cell in your body is a structural and functional unit of your body, similarly, nephrons are the structural and functional unit of kidneys. Okay, you don't find nephrons anywhere else in your body. You find nephrons only in the kidneys. Okay, and each nephron, if you this is how the kidneys have their blood supply. There is a renal artery. Artery will provide kidneys with oxygenated blood. Okay, and this renal vein, the blue vein that you see, okay, it will take the deoxygenated blood away from the kidney, filtered blood also away from the kidney. Okay, these are the various areas of the kidney, if you just notice. Okay, cortex, medulla. Okay, this triangle pyramid kind of a shape is called medulla. Okay, the other area, the space between the different medullas are cortex, renal pyramids. Okay, these are the collecting ducts, minor calyx, major calyx. They form together and they get the ureter. This is where from the calyxes, from minor calyx to the major calyx, and from the calyxes to the renal pelvis, and from the renal pelvis into the ureter. This is how the urine moves out of the kidney. This is how the ureter will take the urine, and down you will have your bladder. Okay, to both the ureters from both the kidneys will end into the bladder. Okay, and the urine will be stored there. When the bladder is full, you will feel like voiding. Okay, and this is the nephron. Okay, this is one single cell. Okay, just for explanation purpose. So nephrons, you can see here on the left side, this is the glomerulus. Okay, glomerulus. The if you remember the arteries and the veins, okay, arteries will bring the oxygenated blood here, okay, it will get filtered out, okay, and the blood will go back into the body through the veins, okay. But the main filtration, the main process of filtration takes place here in the glomerulus, okay. And this is the Bowman's capsule. This glomerulus is kind of a hodgepodge of capillaries. What is a capillary? Capillary is the place where your arteries and veins meet, okay. Capillary is the place where your arteries and veins meet. Okay? So renal arteries come here. They bring all the electrolytes, they bring all the protein, they bring all the organic, inorganic component as well as oxygen. Because the kidney also requires oxygen. Okay. So the arteries will bring all these here. Okay. Kidneys will filter out all the unwanted things, and it will take up all the oxygen as well. Deoxygenated blood will go back into the body through the veins. Okay, from one side, from the left side, it is entering, from the right side, it is leaving. Okay, so here, this hodgepodge is called the glomerulus. This is where the renal capillaries are. They interact, they do the filtration. Okay, and it is surrounded by a capsule called Bowman's capsule. Okay, and it goes through a lot of tubules collecting ducts and all. Okay, so each of these tubules that will also filter out. Okay, for example, you can see these red, green and yellow balls that are falling back into capillary. Okay, these part of the cell is also surrounded by a lot of capillaries. What's happening here is that kidney, the glomerulus have filtered out a lot of ions and electrolytes. Okay, but the body's after some time, the body's calcium levels, or maybe let's say sodium levels or potassium levels, is going down a lot. So what the nephron will do, it will give it back the all the ions that the glomerulus has filtered out. Okay, it will give it back into the capillary so that it can take it into the blood circulation. Okay, for example, sodium, any proteins, okay, amino acids or glucose or any other calcium, okay, any minerals or any organic components, if your body is going onto the lower side, if you're getting hypoglycemic, okay, or hyponatremic, if you're going into that situation, okay, kidneys will identify that situation, and whatever ions kidneys have filtered out to throw out of your body, it will slowly start to release it back into the system. Okay, this is the main function of the nephron. Is it clear to all how the kidneys function? About 130 ml of blood per minute is getting filtered in your kidneys. This is the basic function of the nephrons. Okay, basic functions of the nephrons. Students who are not from a science background, just to make you understand. Okay, just because the kidneys have filtered out unwanted things from your blood doesn't mean everything will go into the urine. It still has a chance. All the unwanted items that had been filtered out, it still has a chance to go back into the body only if the body requires it. Okay. It's a continuous process. It's not a time duration. It's a continuous process. Okay. As soon as the kidneys get the signal that something is going going down, immediately the process will start to shift. Okay. So these are the main functions of the kidneys. First is your excretion of waste. Okay, urea, amino acids, ammonia, creatine, creatinine phosphates, drugs that you eat, okay, that you have used, medications that you have used, all the components of it to be taken out of your body. The main excretion is done by kidneys. Okay, blood iron regulation, sodium, potassium, calcium, chloride, phosphate. Okay, to regulate the electrolytes in your blood. pH regulation. Okay, your body should not be too acidic, it should not be too basic as well. Okay, so to keep that pH balance. Hormone production, okay, calcitriol, renin, erythropoietin. Okay, these are the three main hormones produced by kidneys. Erythropoietin is produced. Its main function is during your red blood cell formation. Calcitriol, okay, to maintain calcium hemostasis. As I mentioned, when kidneys will filter out calcium from the blood, okay, and calcitriol is a hormone that identifies that if there is less calcium or too much calcium in your system, and it will signal the kidneys, okay, and calcium will be taken back into the system. Renin, it will regulate your blood pressure. Blood volume regulation as well, okay, if there is too much of blood volume, you will the kidneys will eliminate a lot of water, okay. If there is too less of blood volume, kidneys will try to save as much as water as possible, okay. These are the main functions of kidneys. In detail they have mentioned in the textbook, but if you have the understanding of these main function, that is more than enough. Next, coming to the disease conditions. First is glomerulonephritis. Glomerulonephritis. Okay, again, it's an inflammation. But where is the inflammation taking place? At the cellular level. Okay, if you remember, glomerulus, that's a part of the nephron. Nephron is a cell in your kidney. Okay, glomerulus is a part of the nephron. So, if there is any inflammation that takes place in the glomerulus, okay, that we call that disease condition as glomerulonephritis. Okay, and there are two main signs and symptoms for this: hematuria, proteinuria, blood in urine, protein in urine. Okay, these are the two main signs of glomerulonephritis. Okay, you don't have to practice the diet of this, you just have to know the principles. Okay, those who are clinicians, those who are medical practitioners, doctors, they can practice the clinical diet part. For remaining all of the students, this is just for your knowledge to understand how a case is managed, how a case should be managed, okay, by a medical team. So there are other symptoms as well. The person will have loss of appetite, shortness of breath, irregular heartbeat, chest pain, chest pressure, decreased urinary output, okay, edema. Because urine output is decreased, all the water is retained in the body. And where will the water go? Sometimes the water will go around your lungs, okay. Pleural effusion can take place because too much of water in your body, cells cannot tolerate these many water, okay, they will try to push it somewhere, okay. So pericardial effusion or pleural effusion, these are the other signs and symptoms that will come up, other clinical conditions that will come up of chronic nephritis, okay. And when, just imagine when your lungs are surrounded with too much of water, edema, okay, you will definitely have chest pain, chest pressure, you will not be able to breathe properly. So that's how the signs and symptoms are related. Okay. Oliguria means decreased urine output. So what is the dietary management you can do here for such cases? Fluid, it's very constricted because the whatever water content the patient will be taking, the body is not losing it. Okay, the body is retaining as much as water as possible, because the glomerulus, which is supposed to do the filtration, that is not doing its work properly. It is not filtering out. Okay, so body toxins are getting accumulated. Water is getting accumulated in the body. It is not leaving the body as it is supposed to. So you will not pressure the body with more fluid. You will restrict the amount of fluid that the patient is taking. Okay, so 500 ml of fluid per day. Energy, 80 kilocalories per kg body weight. So whatever is the weight of the patient you are dealing with, okay, 80 kilocalorie per kg body weight will be the calorie target. Okay, protein, 20 to 40 gram per day. If there is like too much of protein, depending upon the amount of protein the patient is losing. Okay, if the patient is losing a lot of protein in urine, okay, you will reduce the amount of protein in the diet. Okay, if the protein loss is very less, the patient can tolerate up to 30 to 40 gram per day. Okay, otherwise an average adult, how much protein they should take based on ICMR data? An average adult, average, what should be an average adult's protein intake? Is my screen visible to all? What should be an average adult's protein intake? Yes, it is 0.8 to 0.8 to 1 gram of protein per kg. 0.8 to 1 gram of protein per kg. 1.5 gram of protein per kg you will take only if you have a active life. Okay, if you have an active life, and if you're dealing with an adolescent or a child, then yeah, 1.5 gram of protein per kg body weight can be given. Okay, athletes and all will also have 1.5 to 2 grams per kg body weight. Okay, but for an average individual, an average adult, 0.8 to 1 gram of protein per kg body weight, that is the target. Okay, which is definitely less than 40 gram per day. Okay, it is almost equal to 50 to 55 gram of protein per day. Okay, so but here you can see already the protein intake is on the lower side because there is proteinuria. To manage that, you will not bombard the patient with a lot of protein. Okay, so uh, calcium 1 gram per day. Okay, calcium is 1 gram per day, because calcium again depends on how much the patient is putting out. Okay, what is the urinary output of calcium, how much calcium is getting used up in the body. Based on that, only based on that you will be maintaining it. Okay, sodium just 1 gram, maximum 1 gram a day. Okay, so whenever you are using any let's say, and you are dealing with any patients who have kidney disorders and salt restriction is given, first you have to check how much salt is allowed in their diet. Okay, you may have to go to a jewelry shop person to identify what exactly 1 gram of salt is how much. Okay, because you can't, even if you have kitchen weight and all, it will not be that accurate. Okay, goldsmiths or in jewelry shops, the weighing machine that they have, it is very accurate to the minutest of grams. Okay, to find exactly how much is 1 gram or 2 gram, whatever is the dietary restriction of sodium, you have to take salt to the jewelry shop or anyone who has the goldsmith's weighing scale, and then you have to weigh the exact amount of salt how much you can give. Okay, so that in that way you will find exactly how much you can give them. Then sodium, yeah, potassium 1 mole 1 millimole per kg per day. Again, potassium restriction is given. You are not supposed to give a lot of fruits. Phosphorus 8 to 12 mg per kg per day. Okay, phosphorus also, so certain restriction you have to maintain. Even though, see, even though the calories are too high, you can be as liberal with carbohydrates. Complex carbohydrates, you can be as liberal as possible. And with that, you can achieve these high calories. Okay. You have to give them more like sugary, like sufficient calories can be given even without increasing your protein. Okay. Using sugar, honey, glucose, sago, fats, oil, providing them with starchy food, calorie intake can be increased. Okay. Why? Otherwise, the person will go into a state of catabolism. You don't want the patient to go into the state of catabolism. That is, the body is breaking its own cells and its own protein to make sure that the patient survives. Okay. So with calories, you can be liberal. Fats and carbohydrates, you can be liberal. Focus more on carbohydrates. Okay. Fat in increase you should not do. Carbohydrates, you can be liberal. Okay. Because you don't want protein catabolism to start, and you don't want the patient to go into starvation, because when the patient goes into starvation, when if you are also fasting, your body goes into a state of ketosis. Okay. Ketone bodies will also be there. The kidneys, they have to remove ketone bodies as well. First of all, the kidneys are dysfunctional. You can't put the situation of starvation. Okay. So that ketone bodies are produced, and then now the kidneys have to filter out ketone bodies as well. So be liberal with carbohydrates. Is it clear to all? Cereals and sago seeds in all forms are allowed. Okay. And along with, if the patient is having infection along with the disease condition, if the patient is already having some infection, you can still increase the calories even more by 10%. So sodium intake is restricted here. Dietary proteins may be increased when the protein being lost by the urine, or if azotemia is present, dietary protein is restricted. Okay. But if the patient is not showing any signs and symptoms of proteinuria, you don't have to reduce the protein intake. Okay. Only if there is proteinuria, uh, take away you have to be restrictive with protein. So when protein is restricted, complete proteins like meat, fish, eggs, soy, poultry, this should be given. Okay. Because with only small amount of protein, a small quantity of food, complete protein requirement will be met. Okay. You don't have to go for different sorts of protein supply to make sure all the essential amino acids are given. Okay. So when you focus on eggs, soy, poultry meat, fish, okay, all the essential amino acids are that the patient will get that, okay, without increasing the protein intake. So the management, is it clear to all? And you will see the same theme of the management is repeated in many of the disease conditions of the kidneys as well. Next is nephrotic syndrome. So nephrotic syndrome can be caused by when you do not treat glomerulonephritis on time. It can transfer into nephrotic syndrome. Okay, untreated glomerulonephritis, untreated diabetes mellitus, okay, lupus, amyloidosis, any malaria, okay, when these disease conditions are not treated on time, or there is any delay in the treatment, or not a correct form of treatment was given, okay, that could lead to nephrotic syndrome. Means it's a progression. It's a progression of glomerulonephritis, or it's the worsened situation of glomerulonephritis. Okay. So signs and symptoms here, you will find tachycardia, that is heartbeat increases, edema all over the face as well as on the body, pale skin, and fissures will be there, abnormal opening and cuts on the body, severe vomiting, protein in urea, too much of lipids, okay, in the blood, abnormally elevated cholesterol levels or lipid levels in the blood. And hematuria will also be there, blood in urine will also be there. All the signs and symptoms of glomerulonephritis are found here as well. So coming to the dietary management of nephrotic syndrome, protein is restricted, just like how you will take care of a regular person, 0.1, 0.8 to 1 gram per kg body weight, but you can restrict it even further based on what is the amount of protein lost. That is something only a nephrologist can identify. Okay, when urine test is done, you will know exactly per ml of urine how much protein is also excreted. Okay, so based on that, the amount of protein lost, nephrologist will determine how much protein restriction should be initiated. Okay, high carbohydrate diet will be given, okay, to make sure that calories are met and the body does not go into a state of catabolism. Salt restriction, just 2 to 3 grams per day, not more than that. And fat has to be moderate because there is already high levels of lipids, fats in the blood, circulating in the blood. So that should be moderate. Vitamin C and D supplementation will be given. Fluid is restricted based on the urinary output. Fluid restriction completely is on the urinary output. What was yesterday's urine output? Along with that, what is the regular loss is based on the adult's height, weight, age group, activity level. Okay, based on these losses of water plus what was yesterday's previous days urine output. Based on that, the clinicians will calculate how much water should be or how much fluid should be allowed. In some cases, in severe cases, the patient will not be able to take more than 2000 kilocalories, but minimum 2000 kilocalories should be maintained with a high carbohydrate diet. And while making food for nephrotic syndrome patients, while making the food, salt is not at all added. Salt is only added at the end when the food is being served to the patient under restriction. Food that are low on sodium can be used liberally. So that's about nephrotic syndrome. Again, here high quality proteins can be given, like high quality egg, meat, cereals with milk. Okay, these can be given so that protein restriction is also there. Along with that, all the essential amino acids are also met. And patient, if patient is suffering from obesity or patient has abnormal weight for height, that should be corrected. If nephrotic syndrome is not treated on time, it could lead to renal failure. So that is the next topic, renal failure. Acute renal failure and chronic renal failure. That are the two types of renal failure. What happens here is kidneys don't function at all, or the kidneys are functioning at extremely low capacity. Okay. And what happens here? The kidney is not able to filter blood properly. Okay. In acute renal failure, suddenly it will happen. Okay. And in chronic kidney disease, which means glomerulonephritis was there, then it turned into nephrotic syndrome. Still it was not treated well, or you're dealing with a patient who is very aged or has a lot of other disease conditions like diabetes as well. Okay, in such cases it will turn into chronic renal failure. It will gradually turn, okay, not suddenly. Acute renal failure can happen suddenly, okay. If you are having something very toxic, okay, you had something very toxic or some poison or certain drugs, you were on a specific kind of drugs for a, or you had some substance abuse issues for a week or a month, it will immediately lead to renal failure, okay. So signs and symptoms: dehydration, fluid overload, hypertension, oliguria, very less amount of urine, and sometimes it is anuria, that is no urinary output at all. Okay. The patient may require dialysis, either hemodialysis or peritoneal dialysis, based on what the what the nephrologist is suggesting on the patient, based on patient's condition. Physical activity, what kind of physical activity should be done will be determined by the physician, because again, water will be lost through sweat, okay, and through sweat certain electrolytes will also be lost. So keeping the amount of water that could be lost, electrolytes that could be lost through perspiration, okay, that is also considered in guiding the patient with what exercise they can do, what they cannot, okay. Resistance exercises will not be prescribed at any cost, okay, but because when you are doing endurance training or resistance training, you will require more protein in the diet, and with certain renal issues, you are on the restricted side of protein based diet, okay. So very low intensity exercise for some just to give you some physical mobility, okay, that would be suggested, just to improve the physical mobility, that would be suggested. But cardio exercises or high intensity exercises will not be suggested in these situations. So acute renal failure, causes of it: something that is pre-renal, okay, a sudden and severe drop in the blood or blood pressure, or there is sudden interruption of blood flow to the kidney, okay, any blood clot, something like that. There is an interruption of blood flow into the kidney, either it could be some plaque as well, okay, cholesterol buildup in the arteries, that is interrupting the blood flow to the kidneys, that could also lead to renal failure, okay. That is pre-renal causes, not because of something that is wrong with the kidneys, but its surroundings, okay, or some external injury, a road traffic accident, and that led to some internal injury to the kidneys ruptured, okay, because of any gunshot wound or any stabbing wound, okay, somebody stabbed a person exactly through their kidneys, okay. So these are severe injuries. So this is not because the person was suffering from something renal, okay, it is external causes that led to a renal injury, okay, or some interruption in the blood flow to the kidneys, and over the period of time, because of the lack of oxygenation, the cell started dying off, okay. That is pre-renal cause. Intrarenal cause: now direct damage that happened to the kidneys, either there was an inflammation, persistent inflammation, some toxins and certain drugs, or infection, okay. Even substance abuse, if people are getting high on specific substances like cocaine, meth, okay, these can also cause renal failures. Certain drugs, long-term use of certain drugs, infection, persistent infection, okay, not treating the underlying infection, or reduced blood supply. These all are the intrarenal causes. From within the kidney, something is wrong, and that led to the renal failure, okay. Then we have post-renal causes. After the kidneys, what comes? It's the ureters, bladder, urethra. You can see here, okay, ureters, that is coming out of the kidney, from both the kidney, okay. So if something goes wrong in the lower part, the organs that are the parts of the organs that are below the kidney, okay, some obstruction or some infection is going upwards through the ureter, okay, or some block is there in the ureter. So the kidneys are healthy, they are producing urine, okay, the urine is getting excreted out of the kidney, but it is getting stuck here. It will start causing inflammation. Inflammation will spread back up to the kidney. Okay, so that's how it leads to acute renal failure, some obstruction in the urine flow. In men, enlarged prostate gland, 50% of the men will suffer from this. Okay, half of the male population will suffer from this. Just give me a moment, 1 second. Yeah, am I audible now? Okay, so post-renal causes of anything that happens below the kidney, beyond the kidneys, and that have impacted kidneys function. Okay, enlarged prostate, 50% of the men will suffer from this, especially after the age of 40. Okay, they have to get their prostate checkup done. Okay, BPH, benign prostate hyperplasia, is a very common disorder among men. Okay, after midlife. So enlarged prostate can also cause this obstruction. Kidney stones, okay, that can also cause obstruction. Any tumor in the bladder, injury to the bladder, okay, urinary infections that have spread from the urethra to the bladder and it is traveling upwards, urinary infections. Okay, these can also cause obstruction. Okay. Am I audible to all? Next is symptoms of acute renal failure: decreased kidney function, electrolyte imbalance, obstruction in the urinary tract, blood in urine, reduced urinary output, dehydration, detectable abnormal mass. When you do the palpation, when doctors do the palpation, they can find in men, they can find the prostate gland is enlarged, okay, or if there is any tumor that can be palpated. There could be some tenderness as well wherever the obstruction is. Skin is pale, poor appetite. Okay, and how do you diagnose? You have to do the urinary test, urine test. Okay, your creatinine levels and blood urea nitrogen levels will be checked in the laboratory test, in your blood test and urine test. Ultrasound of the kidneys are done to determine where exactly the obstruction is and what is the size of the obstruction. Okay, kidney biopsy can be done if kidney has some tumor or some tumor from external organ is affecting the kidney. And CT scan can also be taken. Okay, that can also will give you a baseline diagnosis. So that was about acute renal failure. Dietary management for renal failure. Same, you can't go more than 1,000 kilocalories for acute renal failure. High calorie intake, it's desired only with carbohydrates and fat. Protein based calorie is not recommended. All protein based food are stopped if the patient is under conservative treatment, and if the blood urea nitrogen level is rising, you have to stop all the protein based diet. Only 40 gram could be allowed when the hemodialysis begins or peritoneal dialysis begins. Only then 40 gram of protein per day will be allowed. Carbohydrates at least 100 gram per day is essential. Orally, you can give glucose as well with lime. Glucose and lime juice can be given to maintain the carbohydrate level. 500 ml plus whatever is the losses through urine is permitted. What is yesterday's fluid loss plus 500 ml can be given. In summer seasons, you can slightly increase the fluid level because you have to account for perspiration as well. In CKD, chronic kidney disease, hyponatremia means less amount of sodium in the blood. Below normal levels of sodium in blood, that is hyponatremia. In dialysis, you have two types of dialysis, hemodialysis and peritoneal dialysis. So hemodialysis is, you must, when you hear the word dialysis, hemodialysis is the one thing that comes into the mind. That is people going to the dialysis station at hospital. Okay, they have to spend few hours there. There is a dialyzer. Okay, the blood is taken out of the patient's body. The entire blood will go through the dialyzer you see here. This is inside that machine, the dialysis machine. Okay, inside that dialyzer is there. Okay, this dialyzer is called as artificial kidney. Okay, so blood will be taken away from the arteries, a fistula is created. Okay, a fistula is created in the patient's body. It's a small operation that you have to do before starting the dialysis treatment. So a small fistula is created. Fistula, which means there is a part in your arm or on your thighs or on your groin region, okay, where the arteries and veins will be interconnected. Okay, surgically it is done. First, you have to do the fistula operation, then only this dialysis, hemodialysis can be started. Okay, so blood will be drawn. Okay, and continuous process of dialyzing filtering the blood out, and the filtered blood will be put back into the body. Okay, so this is the hemodialysis process. One needle will draw the blood that contains waste products. Okay, and that is the arterial blood. Okay, and it will go through the dialyzer. The other needle will return the clean blood from the dialyzer to the body. That is the process of hemodialysis. In peritoneal dialysis, there is no specific operation that is required. Okay, directly into the peritoneum of the patient's body. Peritoneum is just under your stomach. Okay, you have the peritoneal cavity. Okay, in the peritoneal cavity, you have all your organs placed. Okay, in the peritoneal cavity, you have all the organs placed. Okay, and it's a cavity. Cavity means it's a hollow. And in that hollow, your heart, your liver, a portion of your lungs, okay, so your stomach, intestine, okay, everything is placed in this peritoneal cavity. You can see this cavity. Okay, so dialysis solution, okay, it will be directly injected inside. Okay, just like an IV fluid, it will be directly going inside the, not inside the arteries or veins, it will be led directly into the peritoneal cavity. Okay, and at home also peritoneal dialysis can be done. Okay, so this solution will be hung above above the shoulder level, and from there the dialysis solution will fall into the peritoneal cavity. It will stay there for a few hours. It does not take as long as of a time like your dialysis. Okay, it has to stay inside your body for some time, because this solution will pull all the toxins, all the unwanted electrolytes, extra electrolytes, okay, near your organ from the from the cells of your organs. It will pull all the toxins and it will take it out of the body. Okay, and where you have the drain, in the drain you will have the filtered out waste. Okay, all the waste and the fluid that is not required. Okay, that along with some blood that will be present, and it will be into the it will be taken up into the drainage. So this is the peritoneal dialysis. Dietary restrictions will be continued. People who have chronic kidney disease, they will be advised with dialysis. Okay, so dietary restrictions will continue even for them. Low sodium diet, water restriction, protein restriction will be continued, that they can do at the home level, at home-based care. They can continue the same clinical management. Okay, once a week or twice a week or 3 times a week, they may have to go get their dialysis done. Peritoneal dialysis can be done at home. In dietary management of people who are undergoing dialysis, 35 kilocalories of energy per kg body weight can be maintained. Protein intake slightly increases because dialysis is going on. The patient can tolerate a little bit more of protein. Okay, until and unless the patient is put on dialysis and the patient is suffering from some renal failure, all protein sources are completely restricted. Okay, so 1.5 to 1.3 gram of protein per kg body weight can be given once the dialysis begins. Okay, because we'll see the improvement in the patient's condition after the dialysis begins. Salt also restriction, you can be a little bit more lenient with salt, 3 to 4 gram per day. Water based on the urine output. Okay, every month, once or twice, you have to visit the nephrologist. They will consult you with the urine output. Okay, and based on the urine output, water restriction is declared for the patient. Table 20.8. On page number 468, they have given the nutritional requirement during various stages of renal failure. 468, page number 468, table 20.8. Those who have the new textbook, if the page numbers are different, you can mention that in the chat box. The table name, the name of the table is nutritional requirement during various stages of renal failure. In acute renal failure, end stage renal failure, okay, in the pre-dialysis, before dialysis, what food is given. During hemodialysis, what level of food can be given. Okay, in peritoneal dialysis, what are the changes in the diet? It is given based on energy, protein, sodium, potassium, fluid intake, phosphorus. Okay, it is a table is given, and that is helpful for you to get an information, a snapshot of information. Okay, on how to deal with the patients. This is for the clinical practitioners. Okay. Next, you have the urolithiasis or kidney stones. Lithias, whenever you hear the word lithiasis, cholelithiasis is gallbladder stone. Urolithiasis is kidney stones. Okay. So any stone formation that is lodged in your urinary tract, either in your kidneys, ureters, bladder, or urethra, we call it as kidney stones. And there are different types of stones as well: calcium stones, uric acid stones, struvite stones, cystine stones. Okay, based on what type of stone you are diagnosed with, your diet also changes. Okay, not all, majority of the kidney stones are calcium stones. Okay, majority of them are calcium stones. So kidney stones can take place anywhere, okay, either in the kidneys, in the renal pelvis of the kidney. Renal pelvis is inside the kidney, okay. Renal pelvis is, or sometimes in the calyxes, minor calyx, major calyx, renal pelvis, ureter, urethra, bladder, anywhere the stone can be lodged. Okay, risk factors, it's genetic. Okay, if any of your parents or grandparents are suffering from kidney stones, you also have a high chance of developing that. People who are overweight, not drinking enough water, okay, taking certain medications, and food that is rich in specific kind of nutrients. Okay, food that is rich in oxalate will lead to oxalate stones. Foods rich in uric acid will lead to uric acid stones. Okay, um, calcium rich food, too much of calcium intake can lead to calcium stones. So symptoms of kidney stones, you will have severe pain from the lower back, and it will spread to your groin region. Okay, this is a pain, that sharp sudden pain that spreads from the lower back, from the side of your lower back, and it spreads to the front, towards your groin. Okay, so you can see in the image from back, from where, and in the front part of your body till where the pain affects. Okay, so that part of the kidney is affected. So severe pain will be there, vomiting, fever, and when urination, it is painful urination. There could be urinary infection as well, because if the stones, wherever it is lodged, and the urine is not able to pass through it, urine will be stuck there, and it will lead to bacterial infections. Okay, if urine is stuck anywhere, not able to, urine should not be inside the body for a long time, otherwise it will lead to infections. Okay, frequent urge to urinate, but only small amounts of, or some droplets of urine will be passing through the urethra. Okay, so people who take high amount of animal proteins, okay, like meat, fish, poultry, okay, they can also have a risk factor of developing stone. Pyridoxine deficiency, okay, and that leads to too much of oxalic acid in your body, that leads to oxalate based stones. Vitamin B6 deficiency, okay, that could also lead to oxalate stones. Too much of vitamin C intake, and taking too much of food that is rich in oxalates like spinach, cabbage, tomatoes, okay, that is also a leading cause of stones. People who live in rocky areas, like where you don't, it's a barren land, because you have a lot of rock, you don't have enough earth. Okay, mountainous regions and rocky areas, they are also at a high risk of developing stones, because the water, the natural water they get, is likely to be very hard, because of surrounded by rocky mountains or rocky stones. In India, Punjab has the highest incidence of kidney stones, because they have high fluorine content in their drinking water. So based on the type of stone, okay, what type of stone you are suffering from? Is it calcium, magnesium, carbonate? Okay, so that are called the urine. In such situations, it is alkaline urine. Hence, you have to give acid ash food. Okay, which means if you have alkaline stone, like calcium, magnesium, carbonates. These are the components of your stone, which means you have too much of alkaline. You were used to a lot of alkaline food. Now you have to shift to acidic food. Okay. So here, acid ash foods are meat, fish, fowl, shellfish, egg, okay, dairy and other proteins, peanut butter, any types of cheese, okay, bacon, that is pork, okay, nuts like Brazil nuts, walnuts, starch, especially whole wheat, crackers, cereals, macaroni, spaghetti, noodle, rice, okay, starchy, all the starchy cereals, corn, lentils, fruits like cranberries, plums, prunes, that is citrus, okay, berry type of fruits, mm, plain cakes, cookies, okay, these can be given. So acid ash diet should maintain the urine pH between 4.5 to 5. Okay, when you do the urine test, when you do the test the pH of your urine, okay, acid ash diet should make your urine little bit more acidic. Okay. Alkaline ash food, they are prescribed when you have too much of acidic food and you are having oxalate stones, struvite stones. Okay, if you're diagnosed with struvite stones, oxalate stones, it means you will be guided towards alkaline ash food. Okay, so milk products, buttermilk, almond, chestnut, coconut, that are the main fats for you. Coconut oil can be used here. Okay, vegetables, all vegetable except for corn and lentils, what were given in the acid ash food, that should not be given here. Corn and lentils were given there, but not here. Beetroot, all greens, Swiss chard, dandelion greens, mustard greens, spinach, turnips. Okay, fruits, all types of fruits except for berries, cranberries, plum, prunes should not be given. Okay, in sweets, molasses can be used, syrups can be used. Okay, but not desserts, cookies that are made out of maida. Okay, that should not be used. Bakery items should not be used here. So if you suffer from oxalate stones, these are the foods that you have to avoid, high oxalate food that you have to avoid. Okay, if you're diagnosed with oxalate stones, potatoes, sweet potatoes, yams, okay, suran, what we call, okay, that has to be avoided. Legumes and beans will be avoided. Seeds, nuts, wheat should be avoided. All soy-based products will be avoided. Berries, okay, cranberries, raspberries, strawberries, blueberries, all forms of berries that are rich in oxalate will be avoided. Spinach or dark green leafy vegetables, all are rich in oxalate. Spinach has the highest content of oxalate, will be avoided. Beetroot should be avoided. Chocolates, cacao powders, processed meats, pumpkin, eggplant, grapefruit juice. Okay, these will be avoided. Low oxalate food, what can you eat? You can have coffee, low fat dairy, bananas, cantaloupe, papaya. Okay, you can see that are not rich in vitamin C. They are not that rich in vitamin C. They are low on citrus, uh, fruits that are less citrus. Okay, water with lemon. Broccoli can be taken. Iceberg lettuce, bok choy, capsicum. These can be taken. So prevention, it's given on table 20.11 on page number 473. What food you have to avoid to prevent this specific kind of stones. Okay, if you are diagnosed with calcium stones, avoid leafy vegetables, milk products, small fish with bones like sardines, mackerels, prawns, crabs, ragi. Okay, you have to avoid it if you have calcium stones. If you're diagnosed with phosphate stones, whole cereals, whole wheat, bran, legumes, nuts, seeds, banana, carrot, meat, fish, egg, All the milk products, again, organ meat, soft drinks has to be avoided. If you are diagnosed with oxalate stones, again, leafy vegetables like spinach, chocolate, cocoa powder, coffee, Coca-Cola drinks, beef, cashew nuts, beetroot, yam, sweet potatoes will be avoided. And if you have purine-based stones, true white stones, purine-based stones, meat, fish, animal tissues, organs, these have to be avoided. Other part of the food pyramid you can have. A vegetarian plate for kidney stones. Okay, this is how you can plan the lunch and dinner based on the list of food items that you are supposed to eat. If it is acid ash or alkaline ash diet, based on what the nephrologist have suggested you to eat. Okay, in 4 equal portions: fruits, vegetables, proteins, and starches. So that's about kidney disorders. If you have any queries, you can mention in the chat.